And action. Hey everyone, it's DrRic, and today's question is about sleep and medicine. So David and Jana and some guy on the internet, and I'm sorry I forgot your, I had you somewhere on my messages, but I must have erased it. But anyway, if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So sleep. I have done several videos on sleep, so please put the words DrRic question sleep, and I think about 5 of them will populate because it's a really interesting topic. Most of my suggestions are about the same, just rifled through a little differently and stressed, different points are stressed. But the bottom line is a lot of us push the envelope as far as not getting enough sleep. And I know that, you can get by with 4 hours, less than that, 5 hours, just get enough coffee and stimulant and you'll be fine. Well, the brain doesn't work that way. So you're going to pay for it eventually. And eventually what happens is if you keep those habits up, shortening up your sleep hours, your muscle will pay for it, especially if you like exercise. Your performance will decrease, and then your systems, your glands, the thyroid, the adrenals, the gonads, your circulatory system, the endocrine system, like I just mentioned, neurological system, they all will start to not necessarily fall apart. They won't fail, but they won't work right. And you'll suffer, but it'll be slow and insidious. Kind of like the way U.S. medicine is now. We just have little bits of disease added on every year until you turn 50 and suddenly you've got like 5 major diseases and need 5 major interventions. But we don't want that. So I think a lot of importance has to be placed on sleep and love and nutrition and exercise. But sleep, because of because of my guys that are asking, it's important. Food can be used for sleep. I'll kind of go through this real quick. Food can be used for sleep. How? Number 1, not eating too much and causing reflux at night. Number 2, sometimes if you mess around with the macronutrients, and this is not with regards to paleo, keto, intermittent fasting, vegetarian. If you mess around with your macronutrients, make your breakfast and dinner, if you do take breakfast and breakfast and lunch, more protein dominant or fat dominant, so that you don't turn on the insulin response, because insulin makes you sleepy, and then make your dinner or your evening meal more healthy carb heavy or dominant, because you want to be sleepy at night. So you can mess around with that and try to influence drowsiness. Many people, especially when you're really short-cutting your sleep, will get sleepy at about 1 or 2 right after lunch. There's a multitude of reasons why, but if it's because of sleep, change around your sleep pattern. If it's because of food, change around your food pattern. The other things you can also do are having more dedicated sleep. And how do you do that? Well, I like to have a preferential time to start getting ready for bed time. No matter what, 7 days a week. You set that straight. Just like trying to reset your sleep. If you come back in from another country, you have to get that jet lag out of there by forcing yourself to sleep every day, same time every day. Wake up same time every day, even if you're sleepy. You reset your clock. You have to combine what the eyes see as far as darkness and light with what the mouth tastes as far as food, and hopefully you'll get your rhythm. But you have to present a framework first. So if you have the intention set for this is bedtime, this is when I wake up, this is what I'm going to do when I wake up. This is what I'm going to eat when I wake up. And then again, this is how I'm going to wind down before that desired bedtime. To keep that framework, then usually the first week will be tough. But if you keep it on for like 4 weeks, 3 to 4 weeks, eventually when the brain is ready for it and the gut's ready for it and the rest of the senses are ready, you'll slip right in. Maintain that for 4 weeks and you should be rock solid, so that you can then kind of shortcut on weekends if you need to go out. But I think you have to reset your clock first and reestablish. So it's important to set a framework and a deadline. If it doesn't work, then you can use medicines. And the one guy that contacted me online asked about Saguil for initiating sleep. And it can be used for that. Saguil is an antipsychotic medicine, and it can be used off-label for other things. Sleep is one of them. Sometimes depression, bipolar, can be used for. But a lot of medicines nowadays are being used off-label because it has been associated with effects. So you can use it for sleep because it blocks dopamine and histamine, and sometimes that histamine thing is what you'll do when you kind of knock yourself out with Benadryl. Benadryl is over the counter, diphenhydramine, but some people will take that to try to get a little sleepy at night, same time every night, and then bingo, the brain drifts off, maybe. But the only problem with Benadryl is that a lot of folks in the morning will be still sleepy, drowsy, or dizzy, or dry-mouthed, or a little bit short-sighted. Those are the side effects of Benadryl. And we don't need that in the morning because you'll just be tired all day and then you'll be sleepy. So it's a snowball effect. But Seroquel, if you have psychotic episodes or mood disorder, perhaps you get 2 for 1. Maybe that's why your doctor's giving it to you. And if that's the case, using it at night because of its histamine blocker might help. So it just seems like it's a big gun. So I don't know the whole history. If it works, fine. But just like resetting that temporal framework of this is bedtime, this is what I'm going to do, this is daytime, just like doing that, I would say after you've reset your sleep pattern with the medicine, whether it's Seroquel or the hypnotics. There are also hypnotics, Ambien, Sonata, Lunesta. You'll see them on TV all the time. Those are made to definitely drop the brain into this slow wave and make you tired. And hopefully if you're tired enough or the brain kind of gets unplugged, you'll be so tired that your brain, after the effects of the unplugged medicine are out of you, your brain will just stay asleep. Now, if you have, before I got to talk about the examples, those medicines work, but they're really addictive, behaviorally addictive. That means you don't get withdrawal states, but you will be wanting to always have them. So I don't think it's a good idea because if you have other reasons for the insomnia, you're going to be stuck on that medicine for a long time. And it's not necessarily healthy, but we'll talk about alcohol, for example. That's over the counter, obviously, but some people will try to self-medicate with alcohol. And alcohol does make you sleepy, but what does alcohol do? It calms down, it decreases inhibition, and it does work. But if it's too high, it can actually cause other things too. If it's too low, if it's too high, it'll make you drunk and intoxicated. That's not good for the brain. Actually, the brain doesn't get sleep, it just gets knocked out, like unconscious, like getting hit by a fist. And your brain doesn't get rest. Your brain, when it drifts into sleep, has to slowly turn off, power down like a computer, and then this background electrical activity occurs where you get the healing process. The glial cells in the brain clean up all the debris. Brain pathways are reset and or reinforced. Your concepts that you learned earlier are dug in deep. So that's why it's good to not just get unconscious and knocked out. It's also good to get good brain rest. Also, the other thing that happens if you have at least 6 to 8 hours of sleep is your adrenals get recharged. I always talk about the adrenals being recharged if the brain has continuous, luscious, deep sleep. If it doesn't and you have to wake up, then the adrenals don't get 100% recharged and you wake up with a half-charged adrenal, you'll crash at 12, 1, 2, because the adrenals just ran out of cortisol and DHEA. So that's what alcohol does, is it hits you heavy, knocks you out, puts you to sleep, but usually after the liver takes care of alcohol and gets it all degraded, what happens is you wake up just as alert as you went to sleep or right before your first drink. So that's not good. And the other thing that alcohol does is you have to pee it off, so that'll wake you up. So it might help initiate, but then you're up and it doesn't help in the long run. So some medicines can also be detrimental. Over-the-counter medicines like Benadryl. You can also take other things as far as prescription medicines like Xanax or temazepam or clonazepam. Those are all benzodiazepines, and those definitely are addictive. And in fact, they make you sleepy. It's kind of like Valium, all in the same family. They make you sleepy, but they also rob you of REM sleep. And that REM sleep is the stage of sleep that if you get enough hits of REM throughout the night, 6 to 8, then your brain is well rested, and the next morning you feel refreshed You actually get up without your alarm clock, you're ready to go, without needing 12 cups of coffee because you're sleepy. And that's the other thing too. What you do during the day, even early on in the day, can affect what happens at night. So coffee, although it's a stimulant for those of you who are tired, I think it causes way too much reflux. So I don't like it for that reason, because America has reflux. The other thing is too, it might wake you up, and you can use it for exercise. I've used that before for exercise, but if you're using it for sleep, or being too sleepy in the morning, temporarily fine. But fix the reason, which would be get more sleep so you don't need the coffee all the time. Don't just short tail your sleep and imbibe more coffee, because sometimes coffee can have effects on you late in the night. It usually has an effect of where it makes you want to pee. But if you take it during the day, you should be okay. However, brain stimulation can, for the sensitive or sometimes not so sensitive, can still be affected at night when you're trying to wind down and it's still in you. It won't let you do that. So be careful of the use of caffeine. What I'd rather have you use is matcha tea. Matcha tea is green tea, and it has no caffeine in it, but it is stimulating. And you can't overdose on it. It doesn't cause palpitations like caffeine. It doesn't cause high blood pressure. I remember I was reviewing in New Jersey for my boards when I came over from the Philippines, and I probably had a cup of coffee about this big. And I remember at one point I had tunnel vision. I couldn't understand what the guy up there with the lecturer was saying, and I just remember my heart was tacking away and I couldn't calm it down. And then I became anxious, and I had to get my friend to help me and check out my vital signs, and we called 911. And they found that I was just very hypertensive, fast heart rate, and they blamed it on caffeine. So anyway, so that's how you can get side effects from stimulants. There's even caffeine pills. So matcha doesn't have that. The other thing I like too is D-ribose. D-ribose is a sugar. When you have about 5 grams mixed in water in the morning, perfect. Actually stimulates a bit. I like that for exercise too, but it's not going to rock you like caffeine. But if you do enough of that, maybe even B12 sublingual or B12 shot, those things will wake you up. And obviously, I had a patient who said since her hospitalization, she was falling asleep in the middle of the day watching TV. The obvious thing is don't watch TV. Don't do anything boring. So knitting, watching TV, not having conversation, those things, no schedule, those things you don't do when you're trying to reset your sleep. You have to have a desired schedule during the day, and then you have to have your ensured, sanctuary, calming, smelling good, dark, low temperature night to ensure deep sleep. So it's important to have other things. And I talked about stimulants during the day, natural stimulants, but there's also things at night you can take. Valerian, it stinks and it's supposed to be used temporarily, but you can use valerian. Valerian with hops works better. Melatonin spray, melatonin drops, melatonin pills. I have some patients who have headaches when they take melatonin, so watch yourself. And then magnesium. I love magnesium. Magnesium, most Americans are lacking it, if you ask me. And I think that it doesn't really harm. I mean, if you have kidney failure, you can develop high levels of magnesium by mistake. So if you have kidney failure, ask me. If you don't have kidney failure, the biggest thing that will give you a warning sign that you're taking too much magnesium is you're going to poop and get bloated. So if you're having that, either don't buy crappy magnesium, buy magnesium potassium aspartate, magnesium glycinate, magnesium malate, I think that's okay, or magnesium L-threonate. That supposedly crosses the blood-brain barrier fast, and magnesium tends to relax. Magnesium stops palpitations. Magnesium stops muscle cramps. Magnesium helps with insomnia, so that would be important to use at night as well. I did a video for someone on how to use medical marijuana at night. If you are approved and certified for it, then that too will calm down the brain. That helps more for people who have chronic pain, fibromyalgia, post-traumatic stress disorder, but if you're having issues and you're in Colorado or California, you might want to pick up some marijuana as far as medical cannabis, let's call it. But as far as what type to use, vape versus smoke versus edible versus tincture, whatever's fast acting. That kind of depends on what your sleep issue is. If you have problems getting to sleep, you want all that stuff up front. If you have problems staying asleep, you might want to get something that'll last in your system for a while. And again, I don't have any problems with Ambien or Sonata or Lunesta. Some people, if they need it short term, they might need the extended version, because if you can get to sleep but you have problems waking up in the middle of the night, you might need to take the pill before you sleep and then have it in you until the morning. The side effects are not that bad. Watch the warning signs, and you can read the label on side effects. But I would want you off of that once you fix your framework, once you fix the reset of your sleep cycle. So hopefully you don't need that stuff forever. So those are things that you can do to embrace and try to reset your sleep. Medications, if it's necessary to use them, fine. But if there is a underlying medical disorder, fix it. Maybe doing that, or maybe even looking for a sleep disorder. Sometimes a sleep study will find more than just sleep apnea. It'll tell you about a parasomnia you might have. So sleep specialists in the specialties of pulmonary and neurology are really important to consider, as they might be able to observe more than just an apnea issue. They might be able to observe restless leg syndrome. They might be able to observe parasomnias, like I mentioned, and they can treat that sometimes. Or if there's a psychological disorder, and maybe my friend that needs Seroquel has more of an issue at night, who knows? But counseling would help. Counseling and psychotherapy is so important, but we tend to poo-poo that. I don't know why. It's probably because there is apprehension about being labeled or divulging your inner self to somebody else, but it does help. Counseling is so positive that it might even help you walk through that nighttime ritual. And that's part of it too. Having no relaxation practice or calming practice is really common with my guys. My guys don't like calming practice. My guys don't like guided imagery. My guys don't like yoga, tai chi, too soft. But you know what? I think that's why most men die early, is because they avoid being too soft. I'm not talking about erection. I'm talking about kind of nice and peaceful things. We also make estrogen. We should embrace that. That way you can be a whole, well-balanced human. So that, in a nutshell, is what I would suggest for trying to fix sleep, medicine or no medicine. But it's always trying to get to the source of what caused it. If it was just jet lag, okay, fix it, you should be fine. If it's because of what you're eating, I might have me or one of my friends evaluate your eating plan. If it's because of a medical problem, tumor, actual heart disease, a loved one that's having problems, or anxiety for you, then it should be divulged, should be found out, should be worked on, and should be reversed. I always think there's ways to reverse things before we get to the big gun medicines. If we have to use the medicines, fine. But why not start at the small, soft, early stages of changing lifestyle? So thank you for listening. Otherwise, don't forget to subscribe down below, and I appreciate you watching. Don't forget to watch my next video, and I'll see you in the clinic.